So in this video, we'll be discussing the pros and cons of the UPMC oral pathology residency. So the schedule while we're at the dental school is pretty flexible. In contrast, on rotation, the schedule is more rigid. It really depends on the rotation and the attending that you're working with. But at the dental school, outside of our responsibilities on biopsy service and clinical consults, as well as outside of our scheduled activities every week, we have a lot of free time. And during that time, we typically study, whether it's looking through our robust slide library, reading the various physical textbooks that we have, and we also have digital access to books as well, or working on publications and collaborating with faculty on projects. So it really is a matter of making the most of your time during the workday. And in the beginning for me, it was difficult coming straight out of dental school. I didn't have a lot of structure in the beginning. I was so used to having classes at certain times and having exam dates and homework dates, and but in residency it's much more flexible and it's more self-directed. But with time you'll find your footing. You'll find what study methods work best for you, what to optimize while you're in the office. So for instance, looking through our slide library, since we're not allowed to take home our slides or the physical books, taking advantage of those resources while we're here, for me has been helpful in my learning. So it's both a pro and a con to have such a flexible schedule. Another pro is that we don't have to accession our own cases. Dermatopathology handles that, and accessioning can be pretty time consuming. I did it in the beginning of my residency prior to dermatopathology taking over the technical aspect of the service. So they handle all of that paperwork, so that saves time for our schedule so we can spend more time studying or working up the cases. Though one disadvantage is that we don't routinely gross anymore.
Yes, that is true. However, we do have gross labs in which we actually have a hands-on experience in grossing. And we do also have hands-on experience in doing sutures, in grossing, and also in taking biopsies as well, using both the pigs and cow tongues, which is something that's very important.
Right, yeah. So we get to practice grossing and even inking. And of course, when you're on rotation, you can observe.
Yes, in dermatopathology, we are allowed to observe them and even participate in grossing.
Mm-hmm. So there still is some exposure for grossing, and it's an important skill to have because it helps you understand the orientation of the specimen. And I would say another advantage is that we have a pretty diverse array of cases that we get on our biopsy service. We get just over 3,000 cases a year. Typically, I would say we get between 10 and 20 cases a day, at most 30. And that's a good amount of cases. It's not too much, not too little. It's just right. And in instances where we need more information, such as a radiograph or a clinical image, we do have the time to contact the offices to get those materials. And that is most certainly helpful, not only with respect to our learning, but also with respect to rendering a more accurate diagnosis. So I think that's another advantage to the program, is that we have just the right amount of cases where we can take time to really delve in and give the most accurate diagnosis possible.
Pittsburgh itself is a very affordable city and has a very, very good transportation system. So that's a very, very huge advantage in this area, yeah.
Right, and as UPMC residents, we do receive a pretty nice salary. We have insurance, medical insurance, dental, and vision, and we also have a retirement plan. So it's a nice package. It's a good position to have. It's a comfortable job. So we hope you found that pro and con weighing out helpful, and thank you for watching.